Hi, I'm Laurie Edmiston, Executive Director of CATIE. I'm here to tell you about an upcoming event we're going to be hosting this fall. On September 18th and 19th, we're hosting the CATIE Forum, New Science, New Directions in HIV and Hepatitis C. We invite all of you who are working across the entire continuum of prevention care, treatment, and support to join us. CATIE Forum will engage frontline service providers and public health professionals in talking about our collective national response to HIV and Hepatitis C. We will look at what's being done in the field now, and we will explore ideas and themes that are relevant to the overall Canadian response to HIV and Hepatitis C. We will also address the unique challenges you may face in your region.
There's some real opportunities that we still need to explore to get into much more of those detailed applied discussions about integration. So the models that people developed are great, and I think are helping people begin to think differently, but we need to, and in some cases pretty quickly, get down from 30,000 feet to the weeds.
We have to step outside of those silos. We have to really look as community agencies at multidisciplinary, interdisciplinary partnerships that look at clinical services, that look at rehabilitation services, that really look at the holistic care that people living with HIV/AIDS need and that our communities need in order to really respond effectively.
In Saskatchewan, we'd like to adopt, and we will be working towards a mentorship, a multidisciplinary team approach. So not only physicians mentoring, like our ID physicians mentoring physicians in communities, but also our nurses mentoring nurses in communities, and pharmacists and social workers and mental health and addictions mentoring folks in those communities.
The focus in my mind has to be on the health and well-being of and the human rights of people living with HIV/AIDS first, recognizing that with better access, with better knowledge, with better sexual health information and support, the more well I am, the better I will be able to protect those that I'm engaged with and interact with and am sexually involved with. And that will automatically impact transmission.
We keep hearing about what about the people who are HIV negative, and I think we need to, although treatment and prevention are very key and should be part of our focus, we can't forget about the education and awareness that's very important as well. So even those who are testing HIV negative, what kind of education do they need? What kind of supports do they need to stay HIV negative?
Les principes de base dont le consentement, le counseling, la confidentialité doivent être maintenus. Que le consentement, en fait, a souvent été présenté comme une barrière au dépistage. Puis je pense que ça a été soulevé ici qu'on doit faire attention, qu'en fait les barrières sont souvent au niveau structurel, que c'est dans les structures ou l'accès aux services, dans les attitudes, dans les perceptions qu'on retrouve les plus grandes barrières, puis qu'en fait la barrière n'est pas vraiment au niveau du consentement.
I think the main challenge for nursing now in Canada with HIV is the criminalization. The Supreme Court decision, which has actually made things worse rather than better. It brings up unique challenges for nurses around documentation, around what we're legally obliged to record in our notes and how we therefore protect ourselves but also protect our patients.
We need to give direction to our frontline folks about how to messages to share with the people that they're working with, the populations they're working with, and we can do that stuff better together.
There's several programs out there, but we're not connecting and talking about that and making that a broader, more coordinated effort. And that would, that's a really simple example of something that we can do and that potentially CATIE could lead.
So I invite you to join us in this important discussion. We want your input. Come to the CATIE Forum on September 18th and 19th in Toronto, or participate through the live online broadcast we will be running throughout the duration of the program. For details on how to register or how to access the live broadcasts, please visit our website, www.catie.ca. I look forward to your participation.